Clinicians and healthcare institutions are confronted with various challenges when it comes to managing conscience-based refusals to provide lawful medical care. Certain approaches can help ensure that patients have access to care, while also permitting clinicians to refuse to offer some healthcare services that they believe conflict with their principles. I'm Stephen Morrissey, managing editor of the New England Journal of Medicine, and I'm talking with Mark Wicclair, an adjunct professor of medicine at the University of Pittsburgh Center for Bioethics and Health Law and a professor of philosophy emeritus at West Virginia University. Dr. Wicclair has co-authored a perspective article about conscience-based refusals in medicine as part of the journal series on the fundamentals of medical ethics. Dr. Wicclair, what do conscience-based refusals by clinicians entail?
Basically, what they entail is that physicians determine that as providing a certain medical treatment is contrary to their very firm basic moral beliefs.
So, in what contexts and for what types of care are these refusals most common?
Well, the most common actually are associated with reproductive health care. That was sort of the origin of, at least in the US, conscientious objection in healthcare was after the Roe versus Wade decision on abortion in 1973. And after that, it's expanded into a number of different areas of healthcare, end of life decision making, genetic testing, but it still has a large focus on reproductive health care.
So, you say in your perspective article that several ethical concerns arise when clinicians refuse to provide legal medical services. What kinds of harm can patients experience in those circumstances?
Obviously, the most fundamental harm they can experience is not receiving necessary medical care, which can be, in the gravest circumstances, life-threatening. In addition to that, there can be just delays in medical care. There could be a failure to get adequate information so they can make informed decisions, so they know what choices are available to them. And there can also be a problem in terms of just feeling somewhat pressured, judged by the physician in terms of their moral character. So, in addition to just whether or not they get medical services, there are a number of issues involved with communication.
And how about harms beyond the individual patient on the medical system or society more broadly? What are the concerns there?
One of the primary concerns is that services will just not be available on a population level. If the location of physicians who provide a certain service, like, for example, medical assistance in dying, there's some areas of the country that where it's legal that there aren't any physicians in a particular geographic location that are willing to provide it. So an entire population can be deprived of access to healthcare.
Despite this, you say in your article that there are reasons to permit at least some conscience-based refusals by clinicians. Why do you think it's important not to ban them entirely?
Primary reason is that allowing physicians to opt out of providing services and participating in providing services is crucial to maintaining moral integrity. And that can be very, very important to people. So if there is a way of allowing physicians to not provide a service because of a conscience objection and still providing the service in a timely manner to patients, that's the optimal solution. Now, sometimes that's just not possible. And in that case, at least in my view, precedence should be given to patient health and well-being.
What approaches can institutions take to make sure that patients have information about legal medical care, access to all types of care, while still permitting some conscience-based refusals?
That's going to be determined in large part by the resources of a particular institution. So, in a large academic medical center, for example, it may be possible to have on call physicians who can substitute for those physicians who have conscience objections. In smaller community hospitals, rural hospitals, it just may not be possible to have physicians available who will cover for those physicians who have conscientious objections. So in large part, whether or not accommodation is possible without sacrificing patient health and well-being is going to depend on the resources that are available in a particular institution.
Finally, you say in your article that important legal and policy issues related to the exercise of conscience in medicine remain unresolved. So, what questions will policymakers and regulators have to address in this area? What issues are beyond the purview of these individual institutions?
One of the major issues is the availability in particular geographic areas of these services. For example, there are now a large number of medical facilities, hospitals that are under the auspices of the Catholic Church. And if a number of those in a particular area don't allow certain types of services like abortion and other reproductive services, that can have an effect on the entire population. And that's beyond the control of just the individual institution. Then there's, as I mentioned before, geographic issues just in terms of the location of particular physicians in particular areas of specialty. And in some cases, in certain geographic areas, they're just not there. Now, there have been certain proposals in terms of licensure that try to address that, but at least in the United States, where we don't have a national health services, that can be really quite difficult to address. Finally, there's a newly emerging conscience. It's not really conscientious objection. It's called conscientious provision, where there are physicians who think they have a moral obligation, moral and professional obligation to provide services that are not legally permitted. And since the Supreme Court Dobbs decision, there are now a number of states that have very severe restrictions on abortions and terminating pregnancies. And in some cases, physicians think very strongly that if they don't perform an abortion, that will risk the health and well-being and even life of the pregnant woman. Now, in those cases, there are no provisions at all for conscientious objection. Another area where this comes up is in gender-affirming care for adolescents. Again, in many states now, that is not permitted. A number of pediatricians believe very firmly that they have an ethical obligation to the health and well-being of their patient. To provide that service, they're not permitted to. And once again, there are absolutely no provisions in those laws for conscientious providers, that is, physicians who believe they have an obligation to provide the services.
Thank you, Dr. Wicclair.